Hello everyone, I am Dr. Rajnandini. I have completed my BAMS from Tilak Ayurved College, Pune, and I am currently pursuing my Masters, that is MD in Rasashastra and Bhaishajya Kalpana. So today we are going to learn about sinusitis. But first, let's know. So there are 4 types of sinuses which are in pairs in human body. They are ethmoid, maxillary, frontal and sphenoid. So the ethmoid sinuses are somewhere around the bridge of the nose. The maxillary sinuses are here near the cheekbones, and both of these sinuses are present from the start of the birth. Then the frontal sinus, which are situated near the forehead in this bridge, and this happen to develop around the years of 7 years of age. And the sphenoid sinuses, these are situated deep inside, near the bridge of the nose, and these sinuses develop after the adolescence of age. So let's get to know what is sinusitis. So sinusitis is inflammation of paranasal sinuses due to viral, bacterial and sometimes allergic reactions also. And there are 2 types of sinusitis. Number 1 is acute sinusitis and number 2 is chronic sinusitis. Now, acute sinusitis, the name itself suggests that it is the beginning of the condition, and it remains from day 1 to day 10. And if this condition persists further, that is, if we do not take a special care of this condition, and if this condition extends up to 12 weeks, it gets converted into chronic sinusitis. So now let's get to know how this sinusitis actually occurs. So every disease or condition has to have some trigger to evolve. Now sinusitis, the name itself suggests that it's a respiratory tract disease, and hence it usually occurs. The main trigger is with the weather changes, the atmospheric changes, the temperature, sometimes air pressure. Now people may think that it only occurs in the cold weather, but that's wrong. The dry air also can trigger the sinusitis symptoms. Also with that, insomnia, not sleeping at proper time, watching your phones like up to midnight or something, watching television, not taking proper rest, eating junk food and eating cold stuff like cold drinks, ice creams in cold weather at not regular hours. These are some symptoms which can trigger sinusitis, and other triggers can also be like hormonal changes in women, like puberty, adolescence, menopause and pregnancy. These are also some triggers which can cause sinusitis. Now let's get to know about the symptoms and signs of sinusitis. So like I told previously about the anatomy, now let's get to know the physiology of sinusitis. So when some dry air or some allergens or some cold factors that affect sinusitis get inside the body, or the air gets to the nasal canal, it enters the sinuses area and it blocks the area. Mucus doesn't drain, and hence the sinuses area, the area gets really packed. So you are not even able to drain the mucus, you are not even able to retain the mucus, because the area, the sinuses, they are already filled with lots and lots of mucus, and hence you start experiencing symptoms like nasal congestion, difficulty in breathing, then the snoring condition gets a bit bad at the night. Then some people may also experience toothache. Then we can experience loss of smell. Yeah, you can get fever. Then pain in the sinus area. Then due to the swelling of the sinus area, the face, the area around the eyes gets swollen, like in the morning time most preferably. And these are the symptoms that start with the acute sinusitis, which again lasts till 10 days. But if these symptoms are not taken into consideration or are not given enough attention, it may last up to 12 weeks, and After that, this condition is called as chronic sinusitis, and the symptoms get worse and it needs medical attention, or it might get converted into hazardous effects. Prevention and cure. So I think we know the saying, prevention is better than cure. So the preventive measures that we can carry at home for avoiding sinusitis or for preventing the symptoms are like, first of all, we have to control the diet. We can increase the number of citrus products like lemon, oranges, etc. And amla also, which can help soothing the symptoms. Then also anti-inflammatory food like chilies, then pepper and turmeric. We can also have turmeric latte, which is majorly or popularly called as haldi wala doodh. So we can have that at night before sleep. Then we can also have turmeric ginger shots at home, and we can use you can use a humidifier at your home to let your air in the atmosphere be a bit humid, a bit wet, to avoid the sinusitis symptoms. So everyone, this was all about sinusitis. Now I'll see you in the next video. Till then, take care of your health. Good luck.